Welcome to today's session, hosted by the Transfusion Medicine Academic Society. Sorry for the disturbances. We appreciate your time and interest in this important topic. I am Dr. Meetu Muralidharan, postgraduate resident in Transfusion Medicine at SCTIMST, and I'll be comparing today's session. Before we begin, few quick housekeeping notes. The session is being recorded for academic purposes. We request all our participants to please keep your microphones muted. If you have any questions, please feel free to type them in the chat box. Before we begin the talk, it's my privilege to introduce the chairperson for today's session, Dr. Vinu Rajendran. Dr. Vinu is currently serving as Assistant Professor in Department of Transfusion Medicine at Sri Chitra Tirunal Institute for Medical Sciences and Technology. He is the recipient of several prestigious accolades, including the Young Scientist Award by the Indian Society of Transfusion Medicine in 2024, the Jaya Jolie Award from ISBTI in 2022, and Niti Prayas Grant awarded for the Innovation in Translational Healthcare. I now invite Dr. Vinu Rajendran to take the session forward. Over to you, sir.
Thank you, Meetu, for the warm introduction. Good afternoon, one and all. It's my privilege to introduce Dr. Yameena Hameed. Meetu, can you change the slide, please? Yes. So, Dr. Yameena Hameed, she graduated from Government Medical College and completed her MD Transfusion Medicine program from there. And she also procured the diploma in aesthetic medicine from Canada. And her key areas of interest are regenerative medicine in dermatology. And currently, she is working as a regenerative medicine clinical specialist at the Zaya Skin, Hair and Laser Clinic, Ernakulam. So, without any delay, I invite Yameena, Dr. Yameena, to present the interesting topic. Over to you, Dr. Yameena.
Okay. Thank you so much, Dr. Vinu. Thank you so much, TMAS facility, everyone in TMAS, because for giving me this opportunity to present my experience in use of GFC in dermatology. So basically, my husband is a dermatologist. So as soon after my graduation, I went forward to acquire this diploma in aesthetic medicine, and my husband and I has been running the skin years by now. So since its inception, we have been doing PRP treatment, and very soon we shifted our all treatments to GFC. We upgraded to GFC, and for the last 2.5 years, we have been focusing only on GFC treatments in dermatology. So without any further ado, we'll just we'll start our presentation. I'll share the presentation soon. Okay. I'll just join from the link once again, okay? I cannot, that button for sharing the screen is not coming for me right now. I'll just join once again, okay?
Sure, ma'am. Sure.
Okay, sure, sir. No problem.
Okay.
Sorry to say, but there will be a slight delay as our speaker is trying to reconnect. Yes, ma'am, your screen is visible now.
Okay, very sorry for the delay. Okay. Am I audible?
Yes, ma'am, you are audible.
Okay. So we'll get started. Okay.
Sure.
This session is all about growth factor concentrate therapy in dermatology. So this PRP, the use of PRP in dermatology has been started since the early 2000s. Even before that, PRP was used in the field of dental sciences, orthopedics, and all. So in dermatology, for aesthetic practice, initially, it was used for wound healing and scar treatment. Later, towards the mid and late 2000s, it came into wide prevalent usage in the field of aesthetic medicines, like in the application of hair restoration, anti-aging, acne scar, and all. And since the 2010 year onwards, it has been widely used along with other energy-based devices like lasers, microneedling with radio frequency, and all. So, but for the past 5 to 9 years, instead of PRP, now GFC is gaining popularity in dermatology. There is a reason because there are a few limitations for PRP. Like actually, the basic difference between PRP and GFC is that in PRP, what we harvest is the concentrated platelets suspended in plasma, and that is the plasma contains platelets and the growth factors are inside the platelets. And soon after the injection of this PRP into scalp and face, this platelets undergoes degranulation to release the growth factors. But in GFC, what happens? We directly harvest this growth factors. So what we inject, the material that we inject contains no cells, only plasma and growth factors. So because this PRP contains a lot of cells, maybe a little amount of WBC contamination and all, there is always a risk of inflammation, which can cause minimal pain and discomfort to the patient during injection and also after that. And as we all know, the preparation of this PRP is operator dependent, highly operator dependent. That is, the best yielded PRP is obtained only after careful separation technique and harvesting technique. So it is the quality directly is proportional to the skill of the operator who performs or prepares the PRP. And PRP, as it contains platelets, can become unstable earlier. It should not get activated prematurely before injection. So the PRP, there was always this time crunch, because as soon PRP is prepared, it should be soon injected. That was also a pitfall. And to get result out of a PRP injections in face and hair, multiple sessions are required, because the amount of the PRP, the growth factors that will definitely come out of this platelets after injection, it varies during each session. So because of which number of sessions were more in a PRP therapy. So due to all these limitations, now there is always a growing interest for GFC in application level. So basically, as I said before, growth factor concentrate is a rich cocktail of growth factors which is obtained by activating one's own platelets. So it is a purely autologous product, so hence it's very safe. And GFC, what we require for GFC is a specialized tube. That's it. So the tube contains everything. It is the quality of the tube that determines directly the quality of the GFC. It's not operator dependent. So if you buy very good quality GFC tube, the tube will have the platelet activating agents and growth factor stabilizing agents lining across inside the tube. So once we take the blood from the patient, once we draw the blood from the patient, we collect the blood in these tubes, and these tube we just mix it well. We mix the blood well within this tube, and we incubate these two for like 30 minutes. And after this incubation, we centrifuge, and what we get is a separated component. That is, there is a gel separation. So what we get is a plasma and lot of growth factors suspended in plasma. So that is the product that we are injecting. So basically, we all know that once platelets gets triggered in the form of injury or in the form of any agonist, it gets activated and releases a lot of growth factors. So the basic difference between PRP and GFC is that in PRP, this growth factor release from activated platelets take place inside the body, that is within the scalp and within the skin. While in growth factor rich concentrate, we are doing it outside the body, that is within the tube it happens. So what does this actually, all the results of PRP, GFC and all is done due to the presence of this growth factor. So the magic is performed by this growth factors. Basically, what does this growth factor do? It go and activate the fibroblast. So fibroblast is basically a cell which is present in the within the skin, a layer of skin, that is the dermis. So it is the function of this fibroblast to create a lot of collagen and elastin fibers, which holds up the skin, which makes the skin very youthful. So these growth factors go and stimulate these fibroblast cells, and which in turn stimulates a lot of collagen, elastin fibers, and a lot of extracellular matrix, which maintains the youthness, turgidity of the skin. And the exogenous growth factors that we provide into the skin will also help in the overexpression of the endogenous growth factor also. So it's like a amplified effect. And we know these are the magic factors which are present within the alpha granules of the platelets, which includes platelet-derived growth factor, VEGF, fibroblast growth factor, epithelial growth factor, and transforming growth factor beta. So all these growth factors do its function at different layers of skin. That is, in the epidermis, it increases the epidermal skin cells. In the dermis, it increases this, what I said before, the collagen, the fibroblast cells. Fibroblast cells in turn increases the number of collagen and elastin fibers. So type 1 and type 3 collagen is the collagen which is abundant in the skin. So this growth factor stimulates the production of this collagen, type 1 and type 3, and increases the elastin fibers, and it increases the hyaluronic acid synthesis. All these are extracellular matrix within the skin dermis. So this GFC has action over the dermis layer as well as the epidermis. So that is how it maintains the youthness of the skin. So in this, we can actually compare how a young and healthy skin look like and how an aged skin look like. That is, there is always this bulk of the skin tissue is made up of the dermis. So this dermis contains this fibroblast cells, the small fibroblast cells, which generate these fibers, these elastin and collagen fibers, which maintains the turgidity, that volume of the skin. So as we age, there will be less production of this collagen elastin by the fibroblast cells, and there will be damage to the collagen and the elastin fibers by UV exposure, sun exposure and all. So all this will cause the fibers, the collagen fibers, to get disorganized, disintegrated, and there will be breakage of this collagen, and finally the skin will become wrinkled. There is no support system to the skin, so it becomes wrinkled and aged. Like we said, the action of growth factor on the skin, it has very good action on the hair follicle also. That is, it stimulates the stem cells on this hair follicle. Hair grows from the hair follicle. So hair follicle around which it has a lot of stem cells. So this growth factor directly go and stimulate the stem cells to create new hair follicles. And in the existing hair follicle, like in case of androgenetic alopecia, male baldness, what happens is this hair follicle shrinks, it miniaturized. That's what is said. That is a pathological process in which the hair follicle shrinks itself. So finally it becomes closed, that no hair comes out of it. So this GFC can create new hair follicles, as well as it can reactivate the existing aged hair follicle. And also it improves the blood circulation across the follicle, like VEGF we were talking about. So all these can increase the angiogenesis, the new blood formation around the follicle. And the thing is that it can prolong the anagen phase of the hair growth cycle. So this is an anagen, or the growing phase of the hair cycle. In a healthy hair, almost 80% of the hair will be in its growing phase, while 20% will be in its shedding phase, or we call as telogen phase. So what happens in hair loss conditions, be it male pattern hair loss or female pattern hair loss, most of the hair shifts into this falling phase, telogen phase. So most of the hair goes, and there will be a visible thinning in the scalp. So what we do with GFC is that we promote this hair follicle to fall into this growing phase or anagen phase. So when more hair is in its anagen phase, there will be more growth of hair, and you can see that the thickness or fullness in your hair. So like said before, the applications of GFC is wide. It can be used in hair loss treatment, not only for male pattern or androgenic alopecia, but also for female pattern hair loss, females who lose hair because of thyroid problem or PCOD and all. Or even females can also go bald. So in female pattern hair loss, and also for transient hair loss conditions that you can see in female, in case of post-delivery or any surgeries, any stressful, there will be a transient hair loss. For that also, GFC can produce very early result, like maybe in a matter of 1 or 2 sessions. Then it can also be, it is definitely in use for skin rejuvenation, not only in face, but also in neck, hands, and under eye area now, because aging first starts to be seen in under eye area, neck, and hands. So rejuvenation of these areas also can be done by GFC. So that youthfulness of the skin can be maintained. Another application of GFC is in scar treatment, not only for atrophic acne scars, but also for post-surgical traumatic scars, even burn scars. Also, stretch mark is also a kind of scar. So once the family is completed, ladies after cesarean, after pregnancy and all, they can also go for this stretch mark treatment. Also, bodybuilders and all who have stretch mark, they can also go forward with GFC treatment. Also, GFC is also applied in case of this pigmentation condition, like melasma. In melasma, it is stubborn hyperpigmentation of your face. So GFC can also produce magical result for the same. So this is all about GFC. It's very interesting. Now we'll learn how to make or prepare GFC. So in our clinic, what we use is Folly-Rich GFC tube by Vocart. Vocart is a company which produces this Folly-Rich tube for the hair, as well as they have a separate GFC tube for the skin that is called U-Skin. So Folly-Rich comes in a box like this. It will have 4 GFC tubes. Each tube has a volume capacity of 5 ml. We use 4 tubes for a single patient. Vocart is India's first manufacturer of autologous, this ready-to-use GFC kit. It has been in existence for long, and it's very authentic, and GMP certified company is there for that. So basic step for preparation of GFC is very easy, and we can train a person very easily to do the same. So it involves, actually, I showed you 4 tubes for GFC, right? It has a capacity of 5 ml, but we are asked to draw 4 ml per tube. So total about 16 ml is what we collect from the patient directly, and it is equally distributed in 4 GFC tubes. We use a scalp weighing set to draw the blood, so that this process is very comfortable for them. And we gently mix the tube like about 6 to 10 times by inverting it. That is important because, as I said before, the lining of the tube contains platelet activating agents as well as growth factors, stabilizing agents. So the blood should thoroughly mix with these agents to get the desired results. And after which we allow the blood to stand erect for 30 minutes. And it is after this 30 minutes we centrifuge the tubes, and it is per recommendations of WOCAT. We have the speed and time and all, they have recommended themselves, that is 3,400 RPM for 10 minutes. And this will help to separate our GFC. So it is like a gel separation. We get GFC separated from all the cellular materials below. And this GFC can be collected directly from the tube by inserting our collecting, so that the closed system is maintained, so the sterility is ensured. Because there is a gel separating all the cellular components, we can even invert the tube and collect to the maximum, so that not even a drop of GFC is wasted. Now the GFC is loaded into insulin syringes, and now it is ready for injection. We use BD syringes for injection into the scalp as well as face. Also, we have another modality of injection that I'll just describe later. So ideally, before administration of GFC, we have to do a baseline assessment, including the hemoglobin count, the platelet count, and necessary infectious disease screening. So there should be adequate hemoglobin count and platelet count. So platelet count we don't routinely do for patients, but still, if they say that they have recovered from some viral infection, we'll definitely ask them to go and check their CBC before performing the procedure. And the protocol is after detailed assessment by the dermatologist, they come forward for the procedure, and detailed pre-procedure counseling is done. That is what all are the steps that we are doing for this procedure, and how it is done, and what they can expect after the procedure, and the post-procedure care that they have to take after performing these procedures are all detailed, are all explained in detail in the language which is understood by them. And then we get an informed consent form signed from all these patients. And now the procedure is performed. So actually, by the time we draw blood from the patient, we also, at the same time, we apply a topical anesthetic cream to the scalp or face of the patient. So we, in our clinic, we keep the cream for about like 1 hour, 15 minutes for maximum results, so that the injection process will be more comfortable for them. And by that time, GFC will be ready. So the scalp is then cleaned of the anesthetic cream, and then it is cleaned with sterile saline, and then spirit is it's with using spirit we clean the injection area, maybe the entire face or the entire scalp with a cotton, sterile cotton. And then we inject GFC directly, intradermal injection, because we have seen earlier, because we want the action more on the dermal. So we use the PD syringe to inject intradermally, and GFC here the patient is done with seated in an inclined position. Per injection, we drop about 0.05 to 0.1 ml of GFC injected per injection, and it is injected always in a linear fashion. And there is like we just leave a space of 1 centimeter between each injections. And actually, we'll apply this anesthetic cream during this procedure. I mean, before this procedure, but also during injection, we use a vibratory device just to have a distraction, just to make sure that people are further more comfortable during the procedure. So this is a video of how hair PRP treatment is done. Hair PRP, GFC, the content, the concept is both the same. So in this video, we are injecting with a special machine called as mesogun. There is nothing special about it. The thing is that we do it in an automated manner. That is, we can set the depth setting as well as the volume of the content, PRP or GFC, that has to fall during each time. That also, that two parameters we can control, and that's how we inject. And the advantage is that patients are more comfortable than manual insulin syringe injection. But VOCAT team has advised us more to perform GFC with the help of insulin syringes, because that is more, I mean, I don't know whether they have conducted studies or not, but they say that that is more effective. So right now, because the equipments needed for this mesocan injection, they have to be imported from US. So we cannot afford to have, have a regular supply for each patient. So usually we use an insulin syringe. So that was it. In the face also, we do the same. Intradermal injections are done. And we should avoid very superficial injection, okay, because we know the effect maximum to be at the dermis, as well as a very superficial injection can leave like a cobblestone appearance of the skin soon after injection. So as I said before, VOCAT company has a separate GFC kit for the face. U-Skin actually has 2 GFC tubes rather than the 4 hair. So we take about like 8 ml from the patient, and about like 4 ml of GFC will be obtained, and that is used for injection on the face. So roughly it is said that we have to inject 1 ml per cheek, 1 ml for the forehead, nose and chin, and 1 ml for the neck. So this is how a GFC face treatment is done. So that's how the injections are done. Studies also say talk in volumes about the efficacy and the outcomes of GFC injections. It improves the skin texture, elasticity. It helps in remodeling of the scar, not only just for acne scar, but also for traumatic scars. And it shows magical results in androgenic alopecia. It increases the hair density, and it helps to rejuvenate the under eye area. And also it helps, the studies also say that it helps to reduce the melasma. So these are the various studies that have been conducted. So there has been a study which shows efficacy of this GFC for melasma, for wrinkles, for hair loss, and there is another study which compared the efficacy of a PRP and GFC. So that study showed that there is more results on hair density, hair thickness, scalp health scores, and patient satisfaction in GFC group rather than in PRP group. Every client would love to have a great result in minimum number of sessions. So that is how we actually started promoting GFC instead of PRP. So if one person, a patient, who they start getting result earlier, they'll be happy and we'll also be happy. So that's what. And I'll discuss a few before and after pictures of various clients who have come across. All these photos and videograph have been taken after informed consent from these patients. Okay. So this boy is like a 28 years old boy. He's currently taking GFC injections from us. So he's a prospectus group. So he wanted this hair to be correct as early as possible. Definitely, we also had stress. And so this guy, he started minoxidil as well as GFC in that single setting. And he was continuously using minoxidil, and he came. This photo was taken for his 3rd session. That is, with 2 sessions of GFC, he got almost total coverage of his bald patch. He's currently following minoxidil, and he's currently doing his GFC sessions because he wants a little more better results so that he can impress everyone before marriage. So the sessions that we recommend is actually 4 to 6 sessions, that too every month apart, and we advise a maintenance session every 6 to 12 monthly. So it is said that the result that we achieve for like about after 6 sessions, we achieve a result, right? So that result would last for 6 to 12 months. So everyone will ask why it is not permanent, because the disease process, be it androgenic alopecia or maybe the aging skin in case of face GFC injection. Both these I won't say it's a pathology, but still, this process is actually progressing. So, whatever we do to retard this progression should be done constantly so that we can maintain the result. So, this is a hair transformation of a middle-aged guy, and this transformation result was after 6 sessions of GFC. So, he got a almost full coverage of his hair. So it's a beautiful result, but that was obtained after 6 sessions. So the result, the timeline in which the patient gets result definitely varies among individuals. So GFC basically has this advantage of being a simple non-surgical procedure. And the most important thing is it produces an extremely natural looking result rather than an artificial transplantation. And some people are not willing to go for a hair transplantation just because it's surgical procedure and because it gives you a unnatural look. And definitely there is a transition phase in which they have to shave their head and look, everyone will spot them during the transition phase. So most of the people, they want a gradual result, gradual change in their hair volume. So GFC is the best option that they can have. And the thing is that recovery period is also very quick. It can be done like an office procedure. That is, during a lunch break, they can come and do the procedure and they can just resume back to work. And the best thing about GFC is that it is a safe autologous product, because in this age, everyone is a fan of a lot of organic products. So we can market GFC also in the form of completely natural 100% autologous product, because no material or no liquid or any medicine is not added during this GFC preparation product. So because of which there is no risk of transmission of infection. I mean, transfusion transmitted infection or like any allergic reactions. And theoretically, there is less than 1% risk for local infection. But by God's grace, like 3 years we have been doing it, no one has ever reported a infection case. But the thing is that it's just because of the sterile precautions that we have been following during this preparation. And the preparation is completely a closed process. And definitely the pain. Pain is very variable. That is, you cannot, the things that pain me or hurt me may not be painful for another person. So certain people, most of the time it is tolerable, but when we apply anesthetic cream, it may not be evenly thick at all places of your scalp and face. So at certain points, people always complain of pain at certain points. So other than that, it is a completely tolerable procedure. And mild headache, very few people complain of mild headache the day after this GFC. It may be mostly because of because of pain. They clench their teeth and they contract their temporalis muscles. So because of that clenching or that strong muscle contraction, they may feel a post procedure pain. But GFC injections as such won't cause a headache. And minimal itching can be present, but itching was little more common among PRP injections, because during PRP degranulation of the platelets to release growth factors, a lot of people usually complain of itching. But GFC, usually there will be no itching, but it can also be an side effect. And in case of face PRP injection, so scalp, the scalp is covered by hair, so that won't be that obvious. But face, when you do any procedure, definitely, especially GFC injections, there will be a downtime of 5 days. But during these 5 days, there will be mild erythema, mild redness, and there will be injection marks at here and there. But that will be almost, by the post-procedure care that we advise for the first 5 days, it will be almost become negligible by the end of 3rd day and on. The maximum side effect that can come is there's ecchymotic patches that can appear, because at the time of injection, if we inject it to a blood and the blood vessel leaks, it can stain the face, and that can last for 2 weeks. But we say all these things to the patients before, so they will be perfectly fine after the post procedure. So if you want to say limitations of GFC, definitely this multiple session requirement is a limitation. If you want to say as a pitfall, it is a limitation. But more than PRP, GFC requires less number of sessions. Definitely maintenance session is required, as I said, because the disease, progress of the disease is also progressive. So we need something to maintain. And as I said before, because results can vary among patients. Some people will get magical results earlier itself. Some people, it requires, it will take time. But most of the patients will get a beautiful result by the end of 4 to 6 sessions done monthly gap. And in case of severe skin laxity, like deep smile lines or deep forehead wrinkles or frown lines, all these definitely would not give a magical result with GFC. For them, we would prefer to do a Botox or filler. But for a person who is aging gradually, gracefully, who is in mid 30s or 40s, and they want to, they know that they'll age definitely, but they want to age more confidently with a confident face, then GFC is a very good option, because it not only targets each and every just 1 or 2 wrinkles. Like Botox will correct this forehead lines, this cross feet. Only the specific things are corrected by Botox. But GFC it can do magic to the whole of your face. So definitely there are certain people who are not ideal candidates for a GFC injections, like in case of PRP. Those who have an active infection at the site of treatment. If in case of face who has got active, large, pustular acne, we won't suggest a GFC at that point of time. And those who have bleeding disorders or who has severe significant anemia or any platelet abnormalities, we would not suggest. And also patient who is on any anticoagulants, because there is always a risk of bleeding post-procedure, and also it can affect the stability of the platelets, right? And those who have any systemic disease, uncontrolled diabetes, because we don't want any small trigger to flare the status of the patient. And patients who is on chemo or cancer patient, but having said that, we have done, I'll just show you that before after. And the patients who are regularly taking steroids, like omnicortal dose more than 20 mg per kg per day. So these also, this will affect their platelet addition capacity. So that also is like a contraindication to go forward for a GFC injection. And there is a relative contraindication, that is a patient who is a heavy smoker and alcohol abuser, we'll just ask them to avoid. But they can just refrain from using smoking or alcohol just 2 days before and after the procedure, so that the healing process is not affected. And definitely pregnancy is a contraindication for any aesthetic procedures, because we don't want any procedures to just make them feel that because of that procedure something happened to my baby. And for all cosmetic procedures, we always say that the contraindication is the patient who has unrealistic expectations, the patient who expects magic out of one single session. So that is definitely a no. Don't even start the procedure for them. So what all other adjuncts that can be used in GFC therapy for hair restoration? So always for any indication, just done using one particular procedure or treatment as a monotherapy, it is always nice that we combine a lot of things, different types of treatment methodology, be it oral or topical or procedural, so that they get the maximum result out of a procedure in very less time span, because everyone wants faster result, right? So the adjuncts that can be used along with GFC therapy topically, that we almost every day that I encourage patients to start using is minoxidil. Minoxidil has this, it's an FDA approved medicine that has been FDA approved for decades. Its side effect has all been well studied and explored. So minoxidil is very safe to be used topically. It's a vasodilator, it increases the blood circulation to the hair follicles, and like I said before, like GFC, it prolongs the anagen phase of the hair follicle. So or just the day after GFC, we recommend that patient can restart using minoxidil. But minoxidil should be used consistently to get the best possible result. Now, also they can use DHT blockers like finasteride, dutasteride and all. Minoxidil and finasteride comes in combination as hair serums. Now, if for people who do not like using minoxidil and finasteride due to the fear of side effects, all people have this phobia of side effect. So they can consider using peptide hair serum. Because most of the people do not like to consistently use something for their entire life. So peptide hair serum do not require that amount of consistency, but definitely in a case of male pattern baldness, minoxidil and GFC does magic. Then oral supplements that we can use along with GFC are biotin supplements, various iron, zinc, and vitamin D. All these are just supportive, just to make sure that there is no vitamin deficiency that is slowing down the hair regrowth process. That's all. Definitely, there are dermatologists who suggest oral minoxidil, finasteride, dutasteride, and all. But usually we don't give. We get results without the oral tablets. And injectables that can be used along with GFC therapy are microneedling. Microneedling we usually do, okay, that is after direct GFC injection, we do microneedling with GFC for patients, so that it acts like an adjunct. Microneedling as such, it induces the collagen formation in the scalp and all. The collagen, the supportive frameworks, if it's stimulated, it supports the hair follicle so that the hair shedding does not occur. And mesotherapy, it's just mesotherapy means microneedling with some other agents other than GFC. Other like the peptide hair serum I talked about. We get a cocktail of hair growth boosters in the form of a lot of vitamins, peptides, and also these hair meso solutions can be used for mesotherapy. Also, you get injectable dutasteride that also can be performed as a that can also be microneedled into the scalp for better results. And scalp thread, exosomes can be used for microneedling. And scalp thread is a relatively new procedure in which this thread is the same as that of like the suture material that we use. The material is actually poly L-lactic acid or polydioxanone. So these are the materials that comes. It is just like a suture material, very small. It comes with a needle, and we can insert it into the scalp and take the needle off. And the thread stays in place for about like 3 months. Within 3 months, it gets degraded. It is a biodegradable material. So within 3 months, it induces the result. That is, it improves the collagen production. It increases the blood circulation, stimulates the hair follicles, releases growth factors. So this thread has that property. So this scalp thread can also be combined with GFC therapy in the same sessions. That is for patients who are abroad and who cannot afford to come for each and every session of GFC. They can choose to have a scalp thread with GFC therapy for one sitting and follow up with minoxidil. That would give a very good option for them, because they may not be able to continue these sessions abroad, right? Another adjunct that we always do here is the low level laser light therapy. It is just a red laser light which is used to stimulate the hair follicle and increases the circulation, microcirculation in the scalp. It is actually a US FDA approved technology for hair growth. But if you're using this LLT alone, we recommend using it every weekly once. So that is not possible for patient to come back every week, right? So they can. So when they come for GFC therapy, we always start with LLT as a complement. And definitely, it is always a combination of dietary and lifestyle management which always makes the difference. So as I said before, minoxidil, using topical minoxidil along with GFC will synergistically improve the hair regrowth. We get earlier result when a patient using minoxidil comes for GFC. I'm personally very happy because we can get the results in minimum number of sessions. So patient will be happy and we'll be happy. Because that's nice, right? And this is a deadly combination because they can offer a best non-surgical alternative to moderate hair loss in me. So this was a middle-aged person. Again, this person had a very significant androgenetic alopecia, very significant that dermatologist recommended a hair transplantation because the scalp, the front, maybe the first photo, because the hair is frizzy, it is not seen, but there is definitely a clean, shiny patch in the forehead. But he is very adamant that he don't want to go for a surgical intervention. He just wanted something which can give him a gradual result because he don't want everyone to look at him, stare at him post-transplantation. So that's what it was out of his compulsion that he started GFC injections. And this result, that is the result in which the hair in the frontal area where he clearly didn't have any new hair follicles, from there new hair follicles started coming, and his total appearance changed after 7 sessions of GFC. He still comes to a clinic to take 3 monthly maintenance, and he is religiously following minoxidil, and he is a very happy client. And this is a patient. This is a retired nurse from a government taluk hospital, actually. She had CA, and for which she has took a lot of chemo, and she was a patient at RCC. And after that also she received a job. Okay, that was like long, maybe 9 years ago. But since then, her hair was very sparse, and now she retired and she wanted to go to social functions, and having this sparse hair on the scalp was, she was feeling very low, very not confident about that scalp. And she was aged, like maybe like 65 years or something like that. But and we said that definitely the result will be delayed. It will take time, but definitely we can see what how much you will get the result. So she, out of her own willingness, she started GFC treatment, and after 6 sessions of GFC, this was. So actually, she was very pain sensitive. Okay, so for her, we used mesogun, the instrument that I showed you earlier, instead of insulin syringes. So even with mesogun, also we get results. Okay, her very skeptical about whether she'll get result or not. And finally, she was very happy, and she left the clinic very happy to come back again for maintenance session. And she's continuing minoxidil. Okay, she has been using minoxidil since the start also, and she is continuously using the same. So this is like an adjunct, the various adjunct that can be used in the scalp. We have also other procedures that can be done alongside GFC for face also. A lot of resurfacing procedures like fractional CO2 laser, microneedling with radio frequency, and microneedling, simply alone microneedling. All these can also be combined along with GFC. So routinely what we do is, for even be it for acne scar patient or anti-aging, they'll all choose some energy-based device procedure, like maybe laser or microneedling or radio frequency, and alongside we combine GFC, so that all these procedures will create some sort of injuries to the skin, and because of this injuries, the collagen production is stimulated. So that is the mechanism. So adding GFC to all these procedures will increase the wound healing and recovery, and it will synergistically boost the collagen and elastin production, and definitely brings about a faster, earlier result and less downtime post procedure, which is very significant, especially in case of CO2 laser, because the pigmentation, after doing this laser 7 days, there will be a downtime. There will be a very remarkable pigmentation post laser. Not pigmentation, but there will be anyone can recognize that you have done something. So if we add GFC to it, definitely the downtime will be low, and the people will be happy for that. So this is a case which we did very early in our clinic. It was an under-eye rejuvenation by GFC, and this microneedling was done. This patient took an overall GFC injection for her face, but under-eye was definitely always her concern. So this was the result. And next is another case of hand rejuvenation. So this lady is again a nurse who was working in Rajagiri Hospital, and actually she had a burns contractures, the scar and all in hands, which made her hands look very aged. So she wanted change. So we did a hand rejuvenation by GFC. So this post-procedure photo was not obtained, because by the time she was doing this procedures, she had to fly back to UK to continue a job over there. So she left early, but this is a procedure video. So in this, we did everything like this insulin syringe injection, direct injection of GFC, microneedling of GFC, and we also used mesogun because so that she could tolerate more. Okay, next is another example of how we used MNR, that is microneedling with radio frequency. Alongside, we did a GFC microneedling for face rejuvenation. This microneedling radio frequency, definitely that procedure creates little bit micro channels through which when we use this GFC, it can penetrate deeper into it. So other than microneedling, MNRF goes further deeper. It has a more deeper effect to stimulate more collagen. Basically, MNRF is a procedure which is done for anti-aging, acne, scar treatment, stretch marks and all. So another thing is there is a procedure called subcision. Subcision, we can also combine GFC along with subcision. So subcision is a procedure in which we, because post acne and all, they will have a lot of depressed scars, atrophic scar. So these scars are depressed because a lot of fibrous strands are holding them from below. So unless we insert a cannula and strip off these fibrous tissue from beneath, whatever we do on the surface won't work. So when a patient with acne scar comes to our clinic, the first procedure we do is subcision, because we need to break all this fibrotic scar and clear this plane, this dermal plane, so that the skin is now lifted up and is ready to receive any other forms of treatment. So this, along with this subcision, that is through this same cannula, after performing the subcision, after breaking all this fibrotic band, GFC can be injected through this cannula, so that GFC act as like a material which can hold that area. It can direct delivery of GFC into that plane where we need the collagen action can be ensured during this procedure, GFC with subcision. So it's very difficult to get result in acne scar, because people expect unrealistic results when they start these treatments, because all these treatments are costly and they have to be done a couple of number of sessions to get the desired result. So when we always combine multiple procedures at the same setting to get the maximum benefit. Usually what we do is we do MNRF, like I said before, MNRF along with GFC through subcision cannula. We first do subcision and then inject GFC through subcision cannula, and then we perform this MNRF, and lastly we do microneedling with GFC. So we do maximum procedures in one sitting so that they get the maximum result, because at the end of the day, we want everyone to be happy. So this is a boy, he's just 19. So he came to a clinic when he was 18 years old with very stubborn acne all over his face. So he started a skin peel, chemical peels at a clinic, and a lot of sessions, when the number of sessions of skin peel began to grow up, I just even personally suggested him, because he can go forward to and take an isotretinoin tablet for acne reduction. But he was very devotedly doing chemical peel, and finally he got a very great result. His acne stopped popping out, and definitely that violent acne left him with some stubborn scars. So he again approached a clinic for acne scar treatment. So this is the before after result after just 2 sessions of procedure that I mentioned earlier, that is MNRF, GFC, subcision, GFC through cannula, and microneedling with GFC. So all these procedures we combine so that we get the maximum result. So this boy got the maximum result. And for scar, we should never expect result like the skin won't become flawless like it used to be before. If you get 80% result, then that is the best. So this boy was able to achieve that. So finally, GFC is actually a very safe, natural alternative option in aesthetic dermatology, which can be explored even more. And the studies and also our personal experience suggest that GFC is option than PRP. As I said before, when our clinic started, we first used only PRP, but we used to get results with PRP. Okay, but then the fact of what PRP disturbed us was that the quality of the PRP each time varied. It depends highly on the person who prepares the PRP. So GFC, there is no difficulty in preparing GFC. It's very easy. It's not operator dependent. It's just the kit dependent. So we make sure that we buy the best kit so that we get the best results. So that's it.
Thank you, Dr. Yameena. It was a well-structured presentation which covered all the aspects of the growth factor component therapy. Indeed, you have completed all the aspects within a well-stipulated time. Kudos to you. And I had two doubts.
Thank you so much.
Yes. So, what are the quality measures that you adopt at your center during the preparation as well as the administration time? I mean, the quality measures adopted during the preparation and the administration.
Okay. So basically, this kit is actually very reputed. The company is very reputed, and they perform QC on a regular basis. So we do not perform QC as such separately, because the kit contains, and it is for each single kit they perform QC. So they actually give us the reports of the QC. So we don't do any separate QC for the material, that GFC that is prepared in our clinic. And other than that, we make sure that the whole process, the preparatory process, is always closed. We make the loading of this GFC from this tube to the syringe and all, it's done in a closed manner, so that there is no unsterile exposure of this product. And finally, we routinely do not do HIV, HPSC, GHCV screening for every patient, because that is not possible. Every time they have to a card test and come to for this procedure, that is not practically possible. So we make sure that we do it under sterile precautions, so that we do not contract an infection, like a COVID protocol. That's what we follow. And we make sure that the scalp is clean with spirit, full, everything is done under aseptic precaution, so that the patient is also feels very secure to do this procedure.
So once the growth factor is prepared, how long is the shelf life prescribed by the manufacturer for this particular KP?
Yeah, the fault of PRP was that as soon as the PRP is prepared directly, it should be injected as early as possible. But GFC, we have that relief. You know, this WOCA suggests that for 8 hours we can keep it in the room temperature. If in case we are not injecting the same day, we can even change. We can store this at 2 to 8 degrees Celsius for even 7 days, up to 7 days. The proprietary material, this coating of this tubes, contain this growth factor stabilizing agent also. So the growth factors will be stable for up to 7 days at 2 to 8 degrees Celsius.
So definitely another one question everyone will have in mind will be, what are the challenges or hindrances you know face while taking this different path in clinical respiratory medicine in dermatology. So like anyone, I am also intrigued to know.
Okay. Like for me, it was actually, I won't say very easy, but then it was comparatively easy, because my husband is a dermatologist. We both are proud alumni from Trivandrum Medical College. So it was easy for me, I would say, because as soon as my senior residency was done, I just went to the clinic. And the other challenges was just to make sure that I'm always growing. I'm updating myself. Very soon we this injectable PR, that is by Arthrex. It is a US FDA approved machine, and so that this IPRF, I'll be I'll be happy to share all my findings. Maybe the next year, maybe, because we need a lot of people to we need clients to perform, right? So I hope that I just want to make sure that I'm doing something to grow myself as a transfusion medicine consultant in this field, because being an entrepreneur and a doctor is it's a great deal by itself.
So nice. And this outset, there is maybe, and I would like to ask is there any already a observed program or training program at your center, or would you like to plan especially for our residents who may be seeking the same path? What is your take on it?
Actually, we have a center, we have a separate center at our clinic, Zaya Sam Derma Institute of Aesthetic Medicine. Both my husband and myself will be training. So we are very happy. Actually, we have launched it a year before, and we'll be very happy to train any prospectus candidates who would like to choose this path in field of PRP, GFC, or even IPRF. So we'll be happy to do that.
There are certain queries in the chat box as well. So, one query from primary adjacent. What will be the expense from the patient side for each MNRF and GFC for each city? I think it's
Actually, once again, can you repeat the question?
What will be the expense from the patient side for each MNRF and GFC for each city? You can see the question in the chat as well. Chat if you can see.
Okay. Expense actually, you have to call the clinic directly. Because actually it is expensive. It will come around means below within 10,000 if we choose every procedure. It depends upon the number of procedures here that you choose for per single setting. It will be around. It is actually expensive. But results are impressive.
So next question is from Dr. Zaya. So in what all ways a transfusion medicine specialist can support dermatology in a clinic?
Okay, I cannot see the chat box, but I understand that.
I can repeat the question. In what all ways a transfusion medicine specialist can support dermatology in a clinic?
I understand that the question is about what is the role of a transfusion medicine in the field of dermatology.
Now you are working as a dermatologist, or a regenerative medicine specialist. This is the question about as a transfusion medicine, how can they support in a dermatology in a clinic? So yeah.
Basically, I have learned all the aesthetic procedures and I perform all the aesthetic procedures, but my specialty or domain is in the regenerative practices in dermatology. That is, how can we use all the aesthetic procedures that is available and the GFC, the regenerative aspects, prospects that we have.
I think we just lost the connection.
Yeah, I think there's a technical glitch is there. Maybe can you contact Dr. Yameena?
Sure, sir.
So I can also add some points to that particular question. Actually, yeah, as a regenerative medicine, we can other scopes like upcoming other treatment modalities are like stem cell therapy also come into the picture. See, finally, PRP or the growth factor. Like PRP promotes or activates, and it will promote the means release the growth factors, and these growth factors in fact will attract certain stem cells. For other things, that direct stem cell therapy can be, or even now newer proofs are coming, evidence is coming, the exosome or even the particles inside the mitochondria. All these are components of the particles, the extracellular vesicles. These all are can be used for the regenerative medicine purposes. The research potential is actually enormous. I can't even say it is more than that. So even as a transfusion medicine specialist, actually we can be a stakeholder. We can involve in the complexity associated with them. We can provide all these particles from the blood. Dr. Yameena, can you hear?
What I was telling is,
yeah.
Yes. So what I was telling is that, in this era, everyone is seeking for many organic things, be it what they put on their face or be it what they eat. Everyone wants organic things. So that is where our specialty works, because we can specialize more on regenerative aspects of dermatology. Like I said before, we are exploring IPR, injectable platelet-rich fibrin. So that can be injected, as well as it can be injected in and can be used as a substitute for filler. So filler synthetic material. It is a hyaluronic acid only, but synthetic. So what if we can provide the similar result with IPRF, with PRF, then that would be people would definitely seek treatment methodologies like that. So dermatology has an aesthetic medicine, has a space for regenerative practices, and so there is definitely a space for transfusion medicine consultant. So but if we do not take our space, what will happen? Other quacks, that is people who just completed Ayurveda, homeo, and dentist and all, will play with just GFC and all. So definitely there is a space for transfusion medicine in this field, which can be even explored further, so that people would definitely seek for regenerative therapies to enhance their facial structures and to maintain their youth and vitality. So that's it.
So another question was mentioned, BV, I don't know the exact name. How much does the GFC kit cost? So not at the patient level, maybe what is the cost at the lab?
The MRP cost of this foliage tube is 5,500. That is MRP cost. What the doctors get is as per the amount bulk purchase. So that is different. So 5,500.
So another question is from Dr. Pushpita. Any course for TM specialists to learn further in aesthetic dermatology? So you have procured a fellowship or a diploma in aesthetic medicine.
Yes. That is from Canadian Board of Aesthetic Medicine. Definitely, you can approach them. Also, we have I said before, we have an academy where we train dermatologists, and me myself will be training candidates. And it is a fellowship, which is a board certified fellowship by an Indian board. So there are options which we have not started in full swing, but definitely there are. Where I learned is from Canadian Board of Aesthetic Medicine.
So the next question is from Dr. Venita. Is there any licensing required for GFC preparation in the blood center by FDA? So maybe FDA in the sense they would have asked for CDSC or approval, maybe they will be asking. So what is your take on this?
Actually, there is no need of any licensing. The kits that we get from WOCAT is actually CDSCO approved. So there is no further, it is performed by a qualified professional. So there is quacks. I mean, just what I said before, there are people, a lot of clinics with just this Ayurveda, homeo doctors and all performing this thing. So we are so qualified to perform. So definitely there is no need of any further regulations.
So like it should be a licensed clinic. That's all. It should be a registered clinic. That is only required.
That's correct.
Okay, so I think that's the end of the stories. We have witnessed a great interactive session questions as well in the chat box. So thank you, Dr. Yameena, once again.
Thank you so much, Teamas, for giving me this opportunity. So that I'm so happy, and I'm very happy that I was able to share my journey with GFC with all of you. Thank you so much.
So I request me to have the closure.
Yes, sir. With this, we conclude the session. We look forward to your continued participation in the upcoming academic activities. Wishing you all a pleasant day ahead. Thank you, ma'am.
Thank you.